Once again, good morning. We invite everyone to move back to the hall and we begin the sessions now. Sister Anjana Parmar.
Now I invite Father Thomas Nyland, the moderator of the session, to come on the stage. Father Thomas is the Executive Secretary, Projects at the Christian Service Agency, the service wing of the National Council of Churches in India. I invite Dr. L. Ramakrishnan and Mr. Manish Soosai on the stage. I request Father Thomas to welcome them with the plants.
Welcome back, friends. It's my privilege to introduce our two panelists for this session. Dr. L. Ramakrishnan, who is sitting on my right, has been associated with Saathi since 2004. Saathi is an organization called Solidarity and Action Against the HIV Infection in India. He has contributed to developing and delivering gender sexuality content for educators and students of medicine, law and nursing, professional medical associations, lawyers, judicial and police training academies. He has also richly contributed to the 2022 training module for the Supreme Court judges. He has advocated successfully for the LGBT plus inclusion in state health policies and is currently engaged in advocacy for reform of the medical curriculum and practice to be more LGBT plus inclusive. Welcome, Dr. Ramki. On my left is Mr. Manish Soosai, who is the Director of Operations at Saathi. He works to increase access to inclusive services for marginalized communities. He holds a Master's in Social Work and Diploma in Public Health Management. His expertise includes HIV and AIDS prevention, community development, and LGBTQ plus rights. He has extensive experience in private sector engagement and community-based initiatives. Welcome, Manish, for this panel. Both Dr. Ramki and Manish will jointly present to us this presentation on making healthcare inclusive of LGBT plus concerns in India. Friends, we are 11:15. I would request that if you're able to take 15 minutes each for your sessions, as we are overshooting on time, and then we take some Q&A. So over to, are you going to start?
No,
Manish is going to start. Okay. Over to Manish for the presentation.
Thank you, Father Nainan, for moderating this session and introducing us. And on behalf of Sati, I would like to sincerely thank the Ishvani Kendra and Bridge Embrace for inviting us and giving us this opportunity to be with you all. And I really consider this as a great privilege to be among all of you, and I don't consider this as just a conference. I look at it as a great opportunity. I look at this as a new beginning, a new event, more like an inaugural session for new pathways of paths for discussion and dialogues further to be carried forward for inclusion of LGBTIQ community. Mainly, of course, we talk about pastoral care and social inclusion, also of spiritual inclusion, like understanding the LGBT community's need for spiritual experience, experiencing God, wanting to reach out to God, and how do we facilitate that as inclusive method within the church. And thanks for this historic conference, and I'm really glad to be here, part of this, as learning, listening to all of you. This session, before Dr. Ramakrishnan comes, who is actually an authority on this, I would rather take you all through the concepts, terminologies that we all know mostly, and it's just a reminisce what we know to set the stage for all these 3 days, what we are talking about in terms of sex characteristics, gender identity, sexual orientation, sexual behaviors. What do we speak of this, and what is commonly accepted and understood, so that our further understanding discussions which happen with other speakers help us, contextualize and place it in within the context. So we, as part of this entire session, which is now reduced to 30 minutes, we will be talking about the basic concepts of SOGAC that we call about, sexual orientation, gender identity and expression, and sex characteristics, and minority stress, healthcare focus, and way forward. That's what that we would be focusing on. And coming straight to the theme on SOGAC, that what currently we take the last one, the sex characteristics. Sex mostly, like we would say, is an look at it and understand it as an act, but here in the context when we say sex, that on birth, when a baby is born, looking at the genitals, that one is named, termed as male or a female, between looking at what is between the legs, the two legs, between the two legs. So the genital decides whether someone is a male or a female. That's what the assigning at birth on as being sex at birth. But we also have babies who are born with ambiguous genitalia, and those are called, termed as intersex babies. But this intersex is not just only limited to the external organ or the ambiguity of the organ. It also has relations to the chromosomes and the hormones. But we will not go into details of this, but then I just wanted to say that the intersex characteristic is that there are intermediate configurations within the intersex, that it is not just the ambiguity of the genital which is visible when the baby is born. Coming to gender, as against the biological attribute that we have as a sex, gender is more of a social attribute. All of us know, I think most of us who are here come from sociology background, that it is what socially that we constructed, that we are given as roles as man and woman, that how a man or woman need to behave, or what are the culturally appropriate expressions that a man or woman can have. Like for example, man is supposed to be assertive or aggressive, female is supposed to be nurturing, take care of the homes. These are the kind of the gender attributes that are given. That is a social construct. When it comes to gender identity, it comes to the personal aspect of what I perceive or what I feel as who I am. So the gender identity is a person's deep felt or inherent feeling as to who I am. Am I a male or a female or I am a non-binary? That's what when we call is a gender identity. And this gender identity at times could be non-conforming to what the sex being assigned at birth, the biological attribute that is there. And that is what that we call as transgender. Isn't it? That it is not in aligned, my gender identity is not being aligned with the social gender, that's what we call the gender attributes, as well as what we talk about the gender, the sex that is assigned at birth. And this transgender can fall within binary, that is male, female. When a male transgender feels that he is a female, then you have a trans woman, and then a female person feels the gender identity of the person is a male, then you have a trans woman. But there are also persons who do not want to be either in this binary, where we call as non-binary, where they would just want to be called as transgender persons. And cisgender, as you would look at it below the transgender, is those who are like when you have your birth assigned sex, the social gender and your identity are all in line, and those persons are called cisgender. I think these things will be spoken, and also we will have people coming and sharing their life stories, so you will be able to keep what is cisgender, what is transgender, what is trans woman, what is trans man, and what is transgender persons are. Coming to gender expressions, again, like we live in the cultural context, and then we know that within the culture there are social attributes as to how a woman should behave, how a woman should dress, or how a man should behave, how a man should dress, or what are the roles that the person should do, and how that masculinity should be expressed or the femininity should be expressed. And when people fall within that culturally attributed aspects, then we call that they are more of a normative accepted. When those non-conforming, like to those expressions, that's when we call this gender non-conforming persons. And we have gender fluid, like mostly when you say male, we would want a male to have a muscular body, behave, walk straight, whatever. But there are also people who have their expression as being fluid within, having the femininity as well within them as being male, and they would not conform to the cultural aspects of being completely masculine. So this is what we call as gender expression. How does one express gender? I also would like to say mostly that we find this gender non-conformity among the children. Like some of us here, sisters and fathers must be running schools, you will be seeing children who are non-conforming to those gender, the cultural attributes of gender, how a boy should behave, mostly being a boy being with a girl most of the time, or a girl being with a boy. Those are gender non-conforming children that needs attention, support and care. And those children do not always, grow up to be transgender persons. That is what it is. And then initially as being children who are gender conforming also need not always grow up to be a cisgender persons. So the transformation can happen at any point of time, being, from being non-conformity to conformity, from conformity to non-conformity. Now, the next part of it is the orientation. We have the interesting combinations here. It is just not like, as we sing that we always think heterosexualism being the most prominent one that is most accepted. But we do know that there are other diverse sexual expressions. The sexual orientation is what I am attracted to whom I am attracted to, romantically, sexually. So when a male, like if you keep, is there a pointer? Yeah. When I have a male here, when a male is exclusively attracted sexually is what we call male, attracted to women we call heterosexualism. Similarly, woman exclusively attracted to men call heterosexualism. But when a male exclusively is attracted to male is called gay, and then when a female, a woman is exclusively attracted to woman is called lesbian, and then when a male is attracted equally or in different degrees to a woman as well as man, then we have bisexual. Similarly, that is for female. And then when there are more attractions to non-binary and others, then we have the pansexual. It is the attraction, so sexual attraction is pansexual. So this attraction also can be women attracted to non-binary person, man attracted romantically, sexually to non-binary person. So these are the combinations which are there. But these attractions necessarily need not also lead to sexual behavior in itself, as is. So now, when it comes to sexual behavior, we have a male that has sex with woman, and then we have women who have sex with men, but we also have men who have sex with women as well as men, and then non-binary. So these are permutations which could be there. But there are also persons who are asexuals, if you look at here, that they are attracted to people, but sexually they are not attracted to anybody. They are asexuals. These are not celibates. But then they are people who do not have any sexual feelings to anybody. That's why we call them as asexuals. But we could place here the celibates who are here. The celibates who are here, who have taken the vow to be, celibate all life. The orientation might be here, that they may be oriented to man to woman, woman to man, but then have decided not to have any of the sexual behavior. And that's what is about the orientation and the sexual behavior. Yeah, some of the things that we feel that homosexuality, bisexual behavior is all human problem, but it is not so. It's first of all not a problem, and it's not as heterosexualism would think that it is wrong. It is found across 450 species of mammals, reptiles, fish, birds, and insects, and it's not just within the human beings. How does this, the provincial very profoundly spoke about how there is no space for non-discrimination, that there has to be inclusion, everyone has to be accepted. But we do know that among ourselves, we do experience, we also sometimes facilitate that experience of people feeling left out. Just give me a minute. That kind of stress that people feel of being left out, discriminated, stigmatized, rather rejected from family, from society, the pain that people go through because of having sexual orientation is huge, and that's what leads to anxiety, depression, and suicidality. And we know that heterosexism, being the majoritarian accepted normative practice, it feels that rest of them are wrong, are diseased, are sinful, and then we do see that complaints to normative gender expressions, sexual expressions are forced upon people, and that also brings a lot of stress. And we would be actually fortunate to have some of these stories being told to us, and we will really understand when it comes from persons who have gone through that. And we also have family expectations around marriage and childbearing. The male must be homosexual, gay, but then because the family says that they get into marriage and the persons live in marriage, unhappy marriages, you know what the people must be going through. It's not only him. There is another woman who has come into his life. Similarly, for a woman who must be a lesbian but forced into marriage, these things which go on in the day-to-day in our life, and I'm sure that you would have heard certain stories and you would have been witness to some of the pain people have gone through because of this family expectations. And majorly the bullying and other abuse by peers and the children, that bullying that they go through in the schools. And this is one of the aspects that can be taken up as, I do assume that many of us here do have association with a lot of schools, that we can take it up as yesterday Sister Amita was sharing that she does it at schools in terms of sensitizing teachers and the other people on how they should be sensitive to children who are gender non-conforming and make them continue their studies and be supportive, and making the students also be supportive to the children. But these again lead to a lot of stress to children, and we know most of the children drop out from school. They run away from houses because the families do keep telling them to conform to the normative rules. We know because that's again the societal pressure. Nobody is even blaming the family that any being parent would want to do. But again, how that acceptance can come, how that education process that can happen, can we be the facilitators is what that we need to think as we go out from this room after 3 days. And again, the other practices that we have in the country as conversion practice, though it has been by the Psychiatric Association being stated as not acceptable in this country, but we have only in Tamil Nadu and Kerala as an illegal, but people still continue to do the conversion practices which are kind of an abuse on people, which doesn't have any impact, but then people continue to do conversion therapies and conversion practices. And as I said, this all leads to anxiety, depression, suicidality, and the unwanted pain that people go through. Put together all this pain that people we go through, that we inflict on people, is that should move us to being much more inclusive and acceptance. These are some of the statistics which is from American studies. I am sure that in our country this must be much more higher in percentage, that the gay and bisexual boys as against the non-gay and bisexual boys, what's the suicidal tendency that they have or suicidal attempts that they have. It's always higher for those who are gay and bisexual, and all the more, much more higher for those girls who are lesbian and bisexual. And similarly for rejection from family, for transgender persons, and the kind of suicide, attempted suicide at 47% that we see in the American context. If it can happen in American context, it can be in our context, and it must be much more. And we need to have authentic studies in our country to show that what actually is happening, how much we are driving people to take life or making people to take life. Yeah. Oh, sorry. I'm just in the last. I didn't see anybody showing me the. Oh, Father, sorry, I was not looking at you. Okay, this is the last one which already I have spoken about, the school violence. I think we know what kind of violence happens among the gender non-conforming children, verbal, physical, emotional, sexual violence that happens within schools or out of schools for those adults and children, both boys and girls. And that certainly has got psychosocial outcomes in terms of isolation, lack of belonging and anxiety, wanting to take life and moving out of the house, leaving the house. And part of the educational outcome we have that they fall in grades, and then most of them actually drop out of school, and they need to go out of home because they are driven out of home. And that's how we do see some of them getting into begging, which any other thing that must not have been desirable for those children. And I close this here, and I thank you all for listening to me, and I hope I made what is needed for the coming 3 days to understand what we are talking about in terms of the LGBTI. Thank you so much.
Thank you very much, Manish. So I want to quickly shift gear now that you've had the basics. We've seen that even though people are diverse in terms of who they are attracted to, how they identify their gender, whether their body parts are aligned with the binary, What is common to all is the minority stress faced in family, in educational institutions, in workplaces, and now I'm going to talk about healthcare. So, a very brief 5-point summary of what law and medicine say about the LGBTQIA community in India. A couple of these are international points. Since 1990, homosexuality is not considered an illness by World Health Organization. In India, since 2014, transgender people, through the NALSA verdict of the Supreme Court, have full protection and enjoy all constitutional rights, at least on paper. Since 2018, it's not a crime to be in a consensual adult same-sex relationship or same-gender relationship in India. This is an important point because very often when people talk about homosexuality, they often confuse sex involving an adult and a child, or they confuse sex which is non-consensual with sex that is consensual. And we've had section 377 of the Indian Penal Code that penalized same-sex activity regardless of whether it was adult or adult and child, regardless of whether it was consensual or non-consensual. So when we are talking about rights, and we're talking about healthcare, and we're talking about protection, we are talking about relationships between adults that are consenting, and we're talking about protection for children. Okay, so just wanted to clarify that, because there are some people who say, oh, if we support homosexuality, then there'll be a rise in, pedophilia, all of that. That's complete nonsense. Nobody is supporting sexual assault or rape. Just like a marriage or a consensual relationship between a man and a woman is supported by society, sanctified by religious institutions, and endorsed by law. Similarly, but sexual assault or rape of a man by a man on a woman is considered a crime. The same principle holds here, that sexual assault is not condoned in any way. It's only adult consenting relationships that are spoken about, and that since 2018 is not a crime in India. Also, since last year, about a year ago, the Supreme Court said that trans people can actually legally get married to somebody of the other gender. So a trans woman can marry a man, could be a cis man or a trans man. Similarly, a trans man could marry a woman, either a cis woman or a trans woman. So if you look at the history of how LGBTQIA people have been treated through the world, we can go back to biblical times, and everybody must be familiar with Sodom and Gomorrah. The problem here, both addressed by biblical scholars but also by medical researchers, is that there is no clear definition about whether sodomy constitutes consensual or non-consensual sex. So there are some people who argue that what the sin of Sodom was homosexuality. There are other biblical scholars who argue that it was actually male-on-male rape, which, just like male-on-female rape, is not about sexual desire, it is about power, dominance, and control. So even the medical textbooks that often have their roots in the English system, which again has roots in Christian theology, have imported the term sodomy, and until very recently it was considered a sexual crime, regardless of whether it was consensual or non-consensual. Just 2 or 3 important points to make is, in 1990, as I said before, WHO said homosexuality is not a disorder. More recently, in 2019, the WHO has said that being transgender is not a disorder. The label called gender identity disorder is removed from ICD, which is the sort of Bible for doctors. It's the International Classification of Diseases. Okay? Then in India, we've had some developments. In 2022, the Madras High Court, in a verdict, basically said that the medical textbooks in India contain a lot of outdated information and they need to be reformed. The curriculum needs to be reformed, and also you should not be putting words like sodomy is a sexual crime. You need to clearly differentiate between consensual and non-consensual sex. One interesting pattern in all of this is that initially homosexuality in the olden days was just thought to be a behavior that was engaged in by people. It was a wanton behavior, it was rebellious behavior, it was sinful behavior, etc., etc. But with that impression going away, where people realize that same-sex desire is something innate and abiding and organic to the people, a shift in thinking began where the concept of unlawful was replaced by the concept of illness. So the whole idea of this is a psychological disorder in England came after 1957, where the Wolfenden report basically said that people who are engaged in adult homosexual behavior that is consensual should not be considered criminals. So that happened, and that was a good thing. But slowly, if it's not a crime, then there must be something wrong with these people. There must be something mentally wrong. That mindset started creeping in. So always we have to be wary that whether you're saying that this is a legal or illegal, bottom line, it's not illegal. It's a disorder or not, bottom line, it's not a disorder. Even in India, the 2017 Mental Health Care Act speaks very much about non-discrimination based on many factors, including gender identity and sexual orientation. Now I'm going to tell you about some interesting research we have done. So we see that a lot of adult LGBTQI people don't want to go to doctors. For example, if a woman who's lesbian goes to a gynecologist, the first question the gynecologist asks her, or anybody who goes there, is, are you married? So that question, are you married, is supposed to encompass all the assumptions about sexuality and a chance of being pregnant, etc., etc. So a person who's actually lesbian, who's not married and cannot be legally married in this country, who's not even interested in men, will have a very difficult time actually coming and talking to the gynecologist about her STI or RTI or some other gynecological problem. And trans people who are visibly different often face scorn and ridicule even in healthcare facilities. It's very common for a transgender woman to go to a clinic and the doctor immediately regards her as a specimen of curiosity, calls all the other doctors and PG students to look at this person, forces them to strip in a public ward and gets everyone to examine their genitals, which is completely unethical. And these kinds of things have resulted in a lot of LGBTIQ people not seeking healthcare and therefore having poor health. So very quickly in our study, we looked at about 12 different MBBS subjects: medicine, psychiatry, gynecology, pediatrics, dermatology, forensic medicine, surgery, urology, endocrinology. And what we were looking for was, what do the medical textbooks say about LGBTQIA? Is it outdated? Is it wrong? Is it sensitive? Is it current? And we found some horrible things. So if you look at this, this is a textbook of forensic medicine and toxicology, which is now in its 35th edition. So it's been republished without too many changes for dozens of years, for nearly 2-3 dozen years. And this is how they've described lesbianism. Female homosexuality is known as tribadism or lesbianism. Many lesbians are masculine, possibly because of endocrine disturbances, and are indifferent towards individuals of opposite sex. The practice is usually indulged in by women who are mental degenerates or those who suffer from nymphomania. Lesbians who are morbidly jealous of one another, when rejected, may commit homicide, suicide, or both, presumably in that order. So with this kind of content in the textbooks, imagine how the doctors are going to go and give unbiased, non-judgmental care. Imagine the plight of a student who is a student of medicine who's also from the community. And this is not restricted to forensic medicine. If you look at the standard textbooks of psychiatry, if you look at the standard textbooks of pediatrics and gynecology, you find this kind of erroneous material. Even though in 1990 World Health Organization said it's not an illness, even the 2023 edition of medical textbooks say it's an illness. And all of this has changed a little bit with this particular landmark case in 21-22 called Sushma and another versus Commissioner of Police, where two young women who were a couple who faced parental disapproval, parents forcibly separated them, tried to get them married off to men. So they ran away from home. Home for them was Madurai in Tamil Nadu. They came to Chennai, and the police and the parents came after them and abused everybody who was trying to help them. They managed to go on Google, find the address of a contact of a lawyer, and filed a case, which is the Sushma case. And the judge at that particular time, Justice Anand Venkatesh, decided he did not know enough about the subject to adjudicate. So he met a counselor, that's Vidya Dinakaran, bottom left. He met some of us who are from the community and who are doing research and who are involved in activism. So he learned all the issues faced by the community within families, within healthcare, within school systems, within workplaces. And then he gave a whole bunch of rulings, including the fact that the direction that the National Medical Commission should change the curriculum, should change the textbooks. The practice of conversion therapy, where doctors take their child to the parents take their child to the doctor and say, my child is abnormal, change my child, treat my child, cure my child, even though it's not an illness. This practice has now been banned in Tamil Nadu and Kerala High Courts, as Manish said. So this is where, okay, 5 minutes, I'll soon finish. So after this High Court order came, the National Medical Commission has actually changed some of the subjects. And recently I did an article because after the first curriculum came out in 2019, that after 20 years, the 2019 curriculum came, it still had a lot of erroneous content. The Madras High Court said change the content. In 2022, it changed the content, but then again this year, it's come out with some, again, completely outdated content like lesbianism is a pathology, homosexuality is an illness, etc., etc. So a bunch of us, again, filed a petition in Madras High Court, and the net result is now recently, as of last week, National Medical Commission has said we are going to include sexual and gender diversity in pediatrics. We are going to remove the wording of gender identity disorder. We are going to remove the the wording of sexual offense from multiple subjects. So this is a very positive development. There are still some areas of medicine like gynecology that still need to be addressed. So I'm going to actually conclude here by saying that the bodies that develop the curriculum and the hospitals that give care or the private medical colleges that frame their own curriculum need to take a long and hard look at how LGBTQIA people are represented, get their knowledge up to date, both on the science as well as the law, because in India we have laws protecting the community, sodomy is no longer a crime, etc., etc. So we need to remove the outdated content and we have to replace it with current content. So since many faith-based institutions are engaged in the noble cause of providing health care, what I would implore you, along with my colleague Manish, is look at the quality of care. There are many things provided by faith-based healthcare institutions in terms of compassion and empathy, but pay attention to clients, to patients who may not fit the heterosexual norm or the cisgender norm. You don't have to approve or disapprove of their lifestyle. Your personal beliefs may be separate. But as a doctor, your role is to provide unbiased care. And we need training both at the MBBS level, the MD level, the nursing level, and we need community members involved in providing this kind of training and sensitization. So I'm happy to share this PowerPoint if people are interested. And afterwards, Manish and I are open for question. I just wanted to acknowledge my teams here, people who work with us at Sati who are from the LGBTI community. We do a lot of work in Manipur, Odisha, some in West Bengal, in Tamil Nadu, Kerala, Andhra Pradesh, Telangana. Andhra Pradesh, Telangana, we are only working on issues of trans men along with a local group called STAR. So yeah, so thank you again for your patience and we are open to questions.
Friends, we can take a few questions now. I'll request at least welcome 3 questions at a time from the audience. Can we have the mics ready to be passed? This includes session of Ruby as well, if you have questions related to her session as well. Yes.
So Ruby, why don't you come on here? Come.
Okay, we have Brunel here who'd like to raise a question. Yeah, can we have the mics passed there, please? Also,
I just want to ask, thank you, it's nice to see friends after a long time. We worked on the HIV pandemic together. Isn't there a committee, isn't the Supreme Court, kind of putting in a committee or actually asking state governments to put in, or the National Council, the National Medical Commission, to have committees that are actually periodically reviewing and vetting content around these things? Because if there is, maybe a state level or at a national level committee, by experts, activists, queer representatives, then some of these issues can be, systematically addressed.
Right. Should we take more questions?
Yeah, we take 3 questions at a time. Yeah, I saw a few hands there.
Hello. Thank you for this wonderful presentation. I am interested in finding out if Sati has created any material out of their study uh, which can be shared with common people. Thank you.
Okay.
Thank you, sir. That was a wonderful talk that you had given. Sir, I just want to ask something that even though the Supreme Court has ruled that Section 377 of IPC, the criminalizing of homosexual relations, have been banned. I mean, they have ruled out that. Still, there are homophobic and there are offensive jokes have been publishing in social medias. And as a person who's using social media for a constant time, is there anything that we can do from our side, like from a social work perspective, for removing these kind of things? So that's what I just want to know.
Okay.
Thank you.
I saw one more hand there. Yes. Can someone reach?
Yeah.
I would like to know what percentage of population is this LBT and all this.
Come again, please.
What percentage of
What
population?
percentage of population is in this LGBT?
LGBT. Okay.
So we have 5 questions. We can
Yeah,
take
all right.
them. Yeah.
Okay, sister, do you want to go? Yes.
I wanted to know if the same-sex marriage is now allowed or something, what's happening in India.
Okay.
Yeah.
Okay, Manish, would you like to address?
Yeah. Okay, let me try and answer the questions that I remember. Professor Brunel's question. So, National Medical Commission did constitute 2 expert committees, one for psychiatry headed by Dr. Prabha Chandra of NIMHANS and one for forensic medicine. And in 2022, in response to the Madras High Court, these 2 committees have consulted with communities and developed really strong curricula. But NMC seems to have been overcome with amnesia. It's forgotten all of that and it has gone back to the regressive curriculum. So that's one quick response. Before I forget the question about numbers, so we do not have data in India except the 2011 Census of India, where in addition to male and female, they had a third column asking people who did not identify as male and female, and about 4.8 to 4.9 lakh people identified as other than male and female. But we believe this is a huge underestimate, because if the census person is coming home and a person, there's family members, and the person is not out to their family, they're not likely to identify. What we are doing right now, the Supreme Court in 2018, based on studies in the global north, has said a ballpark figure of 8% of the population, which translates to about 10.9 to 11 crores, which is as much as the population of Adivasi and scheduled tribe communities in India. So that would be the number of lesbian, gay, bisexual, transgender, intersex persons. But we don't have an actual study. We have the Supreme Court saying that we are going to assume that this is the number based on studies in other countries. Third question about hate crimes and online media and homophobia. Yes, what has happened is, even though same-sex adult consensual behavior is not a crime, marriage has not been recognized except for trans people. And what we see right now is actually a rise in homophobia, because the same social media is getting people exposed to a lot of homophobic and transphobic memes and posts from Europe and from especially from England and from North America. So we are actually importing homophobia and transphobia afresh. If you want to know what you can do about it, you can actually complain to cybercrimes, and we have succeeded in getting a couple of talk shows taken off because of our report. So that's possible. I've forgotten what the other questions are, but maybe somebody else remembers. Oh yeah, materials. Yeah, so we have developed, we work with healthcare providers, we work with lawyers, we work with educational institutions. So we have developed some materials. We have developed, along with medical students in Delhi at the University College of Medical Sciences, we have developed a small handbook. We are also developing a detailed handbook on gender affirming care for specialist doctors. we contributed to the Supreme Court training module for judges, and we've also used that for training legal service authority panel advocates. For parents, we have not done anything. We know other groups like Humsafar have done, but there is a community group called Orinam in Chennai, which has developed, which is a 21-year-old community group, which has developed material called Our Children in Tamil as Nam Kurandegal and in English. So that material is there, and if you're interested, I gather you're from Swikar, so we'd love to hear about what you all are doing and what materials you've developed, and we can be happy to share what we have. Thank you.
Talking about materials, we have a couple of them displayed downstairs. These are materials, both from the legal perspective as well as the faith and LGBT engagement, and you could have a look at it. They are available to be freely taken, but I would request that you share your details. Some of them require accompaniment, like the training module. There are not enough copies of training module and a few books. We would be happy to send them to you.
Thank you. I just wanted to talk about the question you posed up there at the back. Changing the law is crucial. It's really important to decriminalize homosexuality. But it's only the start of the process, because changing the hearts and minds of people is the big struggle. And in the West, you could say, oh, they've got all these privileges, they can get married, they can have their pension rights and insurance for their partners and all of that. But there's still that stigma from family, from society. And the biggest problem, which has been alluded to, is that the right-wing element, and there's an organization called the Family Breakfast Club, I think it is, in America, where they are pumping billions and billions of dollars into Africa, into Eastern Europe, into Russia, and in India, I'm sure as well. Because and I don't mean to dismiss or decry the evangelicals who came and pushed and promoted their sense of Christianity, they have walked away. They've realized to a great extent that they caused a lot of damage. So this initiative from America is to push back on any advances that are made in society for the LGBT community. So you will find, particularly in Africa, where the bishops are very well funded and are happy to take that money to push back on LGBT rights. So it's a struggle. So you win one massive thing, which is to change the law, but then it's to change the hearts and minds of people who are influenced by their churches, by their political parties, by their societies, their organizations, by their families. And so it's a constant challenge that each one of us has to try and ensure that those privileges and rights are there for everyone.
Just want to add a few more things on the homophobic that you said. Yeah, we need to continue to engage with people at different levels. That's what we do. I think many other civil society do. Even after the law being enacted, that doesn't percolate even to the judiciary. Like if you go and see the state legal service authority, district legal service authority, what has been made, even they would not be aware. So what we do is we engage with them. We have curriculum. Ramki has done sessions for district legal service authority, member secretaries facilitated by state legal service authorities. We continue to bring in the law enforcement authority in terms of the police and others, the women and child development departments, and that is at one level. But then I think we need to continue, rather the bigger element is the community in itself, the general community. How do we engage with them? How do we bring this more acceptable and inclusive understanding with them? Maybe the social media, maybe earlier we used to talk about the media sensitization, but then social media is a larger animal now, where if there is phobic messages which is being given, we also need to find out how our own influencers are able to provide or counter those information with the right information. I think that's what we need to continue to engage at different levels. That's all I think.
Thank you. Friends, I'm having to interrupt here as we are conscious about time. I know there are more questions, and that's a good sign. But please be assured that we are around to have and promote those personal interactions. Both Dr. Ramki and Manish would be around till lunch and perhaps towards evening.
Yeah, all day.
Yeah, they will be here through the day. So please take time to interact with them and get the correct answers to your questions. I'll take this moment to offer a word of gratitude on behalf of all of us here to both Dr. Ramki and Manish for their excellent presentation, for giving us information about definitions of the LGBT, the medical aspects, the legal aspects that are involved, some of those key information. This conference will give you, a tip of ideas of where you could need to read ahead, where you need to go and collect more information. And that's all that this conference is aiming at to provide. So I hope this session has been fruitful to all of us, and also to Ruby for encouraging us and helping us with the keynote. So on behalf of all of us, can we all give a hand of applause to our speakers? Thank you.
We thank Father Thomas, the moderator, Dr. Ramakrishnan and Mr. Manish Soosai for their valuable insights. Now we will have a short break and we will gather back at 12:15 sharp for the Ishvani Day celebration here.